Every day, millions of men around the world quietly pop a small pill, hoping for confidence, performance, and control. But what if I told you that the same medication, Tadalafil, that's marketed as a miracle for male vitality, could be silently damaging your heart, your liver, your hormones, and even your mind? And here's the real shocker. There's a dangerous side effect that doesn't show up in blood tests, and you probably haven't even heard of it. We'll reveal exactly what that is and how to protect yourself in Chapter 6 of this video. But first, ask yourself, are you really using Tadalafil for health, or have you become quietly dependent on it? Could this harmless daily habit be rewiring your body in ways you'll regret 10 years from now? This isn't just about sex. It's about your long-term health, your emotional well-being, and your ability to feel like yourself without needing a pill to function. In today's deep dive, you'll discover what really happens inside your body when you take Tadalafil every day, the slow, silent damage that can accumulate over months and years, and safer ways to support your performance without risking your future. If you care about staying strong, confident, and healthy into your 50s, 60s, and beyond, you can't afford to miss this. Let's start with the question no one's asking. Over the past decade, there's been a quiet revolution in men's health. Tadalafil, once used occasionally before intimacy, is now being taken daily by millions of men across the world. Why? Because it promises more than just performance. Doctors began prescribing it not only for erectile dysfunction, but also for prostate health, urinary symptoms, and even improved exercise tolerance in some patients. Add to that the rise of telemedicine, online prescriptions, and social media influencers praising its lifestyle benefits, and suddenly men as young as 25 are taking it daily, like it's a multivitamin. Let me be clear, Tadalafil can be helpful when used correctly, under medical supervision, and for the right reasons. But here's the problem. Most men are self-prescribing. No blood tests, no cardiovascular screening, no discussion about long-term impact. And that's where things get dangerous. Because even though Tadalafil is marketed as safe, that safety is based on short-term studies, not long-term daily use over years. So before you reach for that next pill, ask yourself, why am I taking this every single day? What do I really know about how it's affecting my body over time? In the next chapter, we'll break down exactly how Tadalafil works inside your body and why daily use may be doing more than just increasing blood flow. And trust me, once you understand the mechanisms, you'll never see this pill the same way again. To truly understand the risks, we need to start with the basics. What exactly does Tadalafil do inside your body? And why does daily use change everything? Tadalafil belongs to a class of drugs called PDE5 inhibitors. It works by blocking an enzyme, phosphodiesterase type 5, which relaxes blood vessels and allows for increased blood flow, especially to the pelvic region. Sounds great, right? But here's where it gets complicated. Tadalafil doesn't just target the blood vessels in your genitals. It affects vascular function across your entire body, including the brain, kidneys, liver, and heart. By taking it every day, you're keeping your blood vessels in a state of chronic dilation. And while that might help with certain symptoms in the short term, your body doesn't just sit back and let it happen. Over time, the body begins to adapt, sometimes in dangerous ways. It may reduce its own natural nitric oxide production. Your vascular system may become less responsive without the drug, and you could experience subtle changes in blood pressure regulation even if you feel normal today. Worse yet, the half-life of Tadalafil is about 17.5 hours, meaning it stays in your system for over 36 hours. So even if you're taking small doses, you're maintaining a constant chemical presence in your bloodstream. It's like leaving a faucet dripping, day after day, year after year, and expecting the plumbing to hold up forever. But it doesn't. In the next chapter, we'll reveal the early side effects most men ignore and why they could be warning signs of deeper imbalances already forming in your body. Most men who start taking Tadalafil daily feel like they've unlocked a secret weapon: more energy, more confidence, better performance. But beneath that surface boost, something else may already be happening, and if you're not paying attention, you'll miss the early signs. Let's look at the most commonly ignored short-term effects of daily Tadalafil: persistent headaches. You might chalk it up to stress or dehydration, but frequent headaches are a classic sign of blood vessel overdilation, meaning your vascular system is being pushed too hard, too often. Back pain and muscle aches. This isn't random. Tadalafil affects smooth muscle function, not just in the penis, but throughout the body. Many daily users report chronic tension in the lower back or legs, often dismissed as working too hard at the gym, flushing, and nasal congestion. You know that slight stuffy nose or red face you get? That's not just a side effect. It's a signal that your circulatory and respiratory systems are under chemical pressure, blurred vision, or light sensitivity. This one is more serious. PDE5 enzymes are also present in the retina. Some users experience visual disturbances, especially in bright environments, but they rarely connect the dots. Digestive upset. Tadalafil can reduce blood flow to the gastrointestinal tract. Mild nausea or bloating might seem unrelated, but your gut could be struggling to adapt. The real danger? Most of these symptoms are subtle and easily ignored. But they're like dashboard warning lights. If you keep driving without checking under the hood, something will break. And here's a crucial point. Your body is not just reacting to the drug, it's adapting to it. And that adaptation may come with permanent consequences. In the next chapter, we'll look at how daily use starts to affect your major organs over time, including your heart, liver, and kidneys. What's happening behind the scenes might shock you. Here's where things get serious. Taking Tadalafil occasionally, your body can usually handle it. But when you take it every single day, month after month, your vital organs are forced to work under constant chemical influence. Let's break it down. The heart. Tadalafil lowers blood pressure by dilating blood vessels. But combine that with exercise, alcohol, stress, or other medications, and your cardiovascular system can get overwhelmed. Some users experience heart palpitations, especially at rest. In others, blood pressure may dip too low, triggering dizziness or fainting. Over time, the baroreceptors in your arteries, which regulate pressure, can become less responsive, putting you at greater risk for hypertensive episodes or sudden drops. Now imagine you're 50 plus, already at risk of cardiovascular disease. Daily Tadalafil use might be silently accelerating the problem. The liver. The liver is your body's chemical filter, and Tadalafil is metabolized primarily by the CYP3A4 enzyme, which also processes hundreds of other medications and hormones. What happens when that system is overloaded? Liver enzyme levels can rise, even without symptoms. Your body may metabolize other drugs more slowly or unpredictably. Long-term strain increases risk of fatty liver or toxic buildup. And here's the scary part. Liver damage often shows no symptoms until it's advanced. The kidneys. Tadalafil increases blood flow and alters filtration pressure. While that might seem helpful, it can stress the kidneys, especially in those with diabetes, high blood pressure, or pre-existing kidney issues. Some users report frequent urination, nighttime urgency, or swelling. These may seem harmless, but can be early signs of renal stress. And remember, kidneys don't regenerate. Damage is often irreversible. The bottom line? You might feel like Tadalafil is helping you now, but your organs are absorbing the cost, one quiet day at a time. And the worst part? These internal effects rarely cause pain until it's too late. In the next chapter, we'll shift focus to the psychological and sexual consequences of long-term daily use, including a dark side that very few men talk about openly, what it does to your confidence and your brain. Here's something most doctors don't warn you about. Even if your heart, liver, and kidneys seem fine, Tadalafil taken daily can quietly start reshaping how your brain functions and how you feel about yourself as a man. Let's unpack this carefully. Psychological impact. At first, daily Tadalafil seems like a confidence boost. You feel more capable, more in control, but underneath that is something more troubling. Over time, many men begin to doubt their own natural ability to perform without the drug. You skip the pill one day and suddenly feel anxious. You start associating confidence with chemistry, not self-belief. You avoid intimacy if you haven't prepared yourself chemically. That's not empowerment. That's chemical dependency in disguise. You may still have the physical ability, but your mind starts whispering, "What if I fail without it?" This creates a subtle but dangerous feedback loop. More anxiety, more dependency, less natural function, sexual consequences. Here's the paradox. Tadalafil helps with blood flow, but overuse can reduce arousal. Why? Because sexual response is about much more than circulation. It involves neurotransmitters, anticipation, confidence, and emotional connection. But when you rely on a pill every day, your brain stops producing normal levels of dopamine and oxytocin during arousal. You become less sensitive to natural cues, both physical and emotional. Erections may remain firm, but pleasure and satisfaction can feel numb. Some men even report a lower libido over time, not because of the drug itself, but because they've outsourced sexual confidence to a pill. And here's the hard truth. If you're using Tadalafil daily in your 30s or 40s, what will your body and your mind rely on when you're 60? You could be building a future where natural intimacy becomes impossible without chemical support, and your partner might feel that too. But it gets worse. In the next chapter, we'll uncover how Tadalafil can create a hidden dependency, not just physical, but emotional and psychological. This is the warning most men never hear until it's too late. This is where the real danger hides, not in your blood tests, but in your behavior. Because unlike alcohol or nicotine, Tadalafil doesn't make you feel high. It doesn't cause withdrawal symptoms in the traditional sense. And that's exactly why it's so deceptive. The subtle slide into dependency. It starts innocently. You try it once, feel great, and decide to take it again before the next big moment. Then you start thinking, why not take a low dose daily, just in case? Soon, intimacy without it feels risky. Your confidence without it, fragile. And now, without realizing it, you're no longer in control. The pill is. You don't need it for performance. You need it for peace of mind. That's not support. That's dependency. Why your brain reinforces the cycle. Tadalafil is a reassurance trigger. It becomes a ritual, a psychological safety blanket that tells your brain, you're prepared, you're strong, you're ready. But the more your brain relies on that reassurance, the more it disconnects from its own natural power. Dopamine release becomes chemically tied to the act of taking the pill. Anticipation is replaced by expectation. Excitement is replaced by routine. Over time, even if your body can perform without it, your mind doesn't believe it anymore. The relationship trap. This doesn't just affect you. Partners begin to notice a lack of spontaneity, a mechanical feel to intimacy, an emotional distance created by your invisible fear of failure. Worse yet, many men keep this use a secret, which only deepens the emotional gap. This hidden dependency can erode trust, intimacy, and self-esteem, all while you're trying to do the opposite. In the next chapter, we're going to get very specific. There are certain men who should never take Tadalafil daily, under any circumstances. And if you're in one of these categories, the risk isn't just side effects. It could be life-threatening. For some men, Tadalafil can be a useful tool, but for others, it's not just a bad idea. It's a serious health risk. If you fall into any of the following categories, daily use of Tadalafil may be dangerous or even life-threatening. Let's break it down. 1. Men taking nitrates for heart conditions. This is the most well-known and most dangerous interaction. Tadalafil dramatically lowers blood pressure. So does nitroglycerin and other nitrate-based heart medications. Combined, they can cause a sudden catastrophic drop in blood pressure, leading to fainting, stroke, heart attack, even death. Important, never mix Tadalafil with nitrates. Not even once. 2. Men with uncontrolled high or low blood pressure. If your blood pressure is unstable, either too high or too low, daily Tadalafil can exaggerate both extremes. It can make high blood pressure harder to control or cause dangerously low pressure during sleep or after standing. Symptoms to watch for: lightheadedness, blurred vision, brain fog, irregular heartbeat. 3. Men with severe liver or kidney disease. Tadalafil is processed by the liver and excreted by the kidneys. If either organ is compromised, the drug can build up in your system, increasing toxicity and intensifying side effects. Even a standard dose could linger for days, overwhelming your system quietly. 4. Men with retinal disorders or vision problems. Because PDE5 enzymes exist in the retina, Tadalafil can interfere with visual processing, especially in those with retinitis, pigmentosa, optic nerve damage, history of vision loss. Even subtle symptoms like color distortion or night blindness can be warning signs. 5. Men with anxiety or depression. This one's rarely discussed, but crucial. Tadalafil can affect mood, emotional regulation, and dopamine sensitivity. If you're already managing mental health challenges, daily use could destabilize your chemistry, making anxiety or depression worse over time. If you fall into any of these categories, speak to a doctor before ever considering daily use, because for you, this little pill might not just be unhelpful, it might be dangerous. But don't worry, there are safer ways to support your performance and vitality without paying the price with your long-term health. That's exactly what we'll cover in the final chapter. By now, you've seen the hidden risks of taking Tadalafil every day. But here's the good news. You don't have to choose between performance and health. There's a smarter, safer way to use this medication without falling into the trap of silent damage or dependence. Let's break it down. Step 1. Use Tadalafil as needed, not automatically. Instead of daily use, consider on-demand dosing, taking Tadalafil only when truly necessary and no more than 2 to 3 times per week. Why this works? It gives your body time to reset, reduces the buildup of side effects, maintains your natural performance response. Remember, less is more when it comes to medication that affects your entire vascular system. Step 2. Address the root causes of ED or performance anxiety. Daily Tadalafil often hides deeper issues. Poor circulation, hormonal imbalance, like low testosterone, stress, poor sleep or relationship disconnect, sedentary lifestyle, or poor diet. Start with a full medical evaluation, not just a prescription. Check your testosterone levels, blood pressure, blood sugar, liver, and kidney function. Then work with a doctor or men's health specialist to address the root, not just the symptom. Step 3. Support your body naturally. Tadalafil isn't your only option. In fact, the strongest long-term results come from foundational health habits like exercise, especially resistance training to boost testosterone, sleep optimization, 7 to 9 hours of deep rest to balance cortisol, and libido anti-inflammatory diet, rich in omega-3s, antioxidants, and plant-based foods, mindfulness or therapy. To reduce performance anxiety, naturally supplements like L-arginine, citrulline, and ashwagandha may also support blood flow and hormone balance, but should be used with professional guidance. Step 4. Take regular drug holidays. If you've been using Tadalafil daily for months, talk to your doctor about weaning off and taking breaks, called drug holidays. Why this matters? It allows your natural function to re-emerge, restores your body's responsiveness to nitric oxide, helps rebuild confidence in your ability without the pill. Yes, it might feel uncomfortable at first, but with the right support, it's reversible. Tadalafil is a tool. But if you're not careful, it becomes a crutch, and then a cage. You deserve more than a chemically triggered performance. You deserve authentic vitality, lasting energy, and real connection, without fear or dependency. Let's wrap this up. Shall I now create the conclusion with key takeaways, emotional reinforcement, and a call to watch a related video? Let's bring everything together. You started this video wanting to know, is it dangerous to take Tadalafil every day? Now you know the truth. Daily use may improve short-term performance, but it can quietly strain your heart, liver, and kidneys. It can slowly shift your confidence away from self-belief and toward chemical dependence, and worst of all, it can create invisible damage that only reveals itself when it's too late. But here's the empowering part. You're not stuck. With the right knowledge, support, and choices, you can reclaim your natural performance, restore your confidence without relying on a pill, and protect your health, not just today, but 10, 20, even 30 years from now. Because this isn't just about sex. It's about your quality of life, your emotional well-being, and your ability to live with strength and clarity without fear. Your turn. Have you ever taken Tadalafil daily? What changes, good or bad, did you notice in your body? Drop your story in the comments. Your experience might help another man out there make a smarter choice. If this video opened your eyes, hit the like button to help more men see this. Subscribe to the channel for honest, science-backed health advice every week. And don't forget to share this with a friend who might be quietly struggling with the same questions. You're not broken. You're not too old. You're not dependent. You just need the right guidance, and you've found it. Let's keep going together.